Hello Sandra, I am your dental hygienist Sunday. How are you doing today?
I am well. It is nice to meet you.
Before we can get started with treatment today, we need to go over your medical history. I see that you are currently 57 years old and your last dental visit was over 10 years ago.
Yes, I am moderately nervous about going to the dentist office. I had a bad experience when I was younger. I only go when I have pain.
To help you feel more comfortable at the office, we will plan short appointments for you and complete treatment at a pace you are comfortable with. Are you currently being treated for any medical conditions? And when was your last medical checkup? What were the results?
I have been going to a walk-in doctor's office. I see a different doctor at each visit. The last visit indicated everything was normal. I have type 1 diabetes. Diagnosed when I was 16. My sugar levels are within normal range. I take insulin glargine 10 units before bed.
It sounds like your diabetes is under control. Have there been any other changes in your general health in the past year?
Yes, I have recently gone through menopause and developed osteoporosis. I take Raxolifan 60 mg per day and calcium 600 mg and magnesium 400 mg supplements to help with bone density. I also recently found out I have seasonal allergies and take fexofenadine 60 mg per day to control them.
Have you ever had any blood pressure or heart problems or any other conditions or medications that we need to know about?
No blood pressure or heart problems. However, I am currently taking an antidepressant budeprion 300 mg per day for the past 3 years since my husband passed away. I also take hydroxyzine 50 mg 4 times per day for anxiety related to my menopause. The doctor informed me that these medications must be taken at the exact doses. The hydroxyzine dose is cut in half because I am on budeprion.
I am sorry to hear about the passing of your husband. It seems like you are aware of your medications and very diligent about the doses. However, you do not have a steady family physician. I feel it is important to refer you to one physician who can monitor your conditions more regularly.
Thank you, I would appreciate that.
I see on your chart that you do not smoke and your diet is low in sugars, which is important so that we can manage your dental health better. What is the main dental concern that you have?
Bleeding gums when I brush, recession and mild sensitivity to hot and cold.
I see on your chart you indicated that you use a scrubbing method when brushing your teeth twice per day.
Yes, my teeth only feel clean when I brush like that.
Thank you for that information, Sandra. Let's start the exam of your teeth.
During Sandra's initial intraoral and radiographic assessment, you also note that her oral hygiene is fair as she brushes 2 times per day and has no previous restorations and slight recession due to the scrubbing action of her brushing technique. You chart that she has moderate localized periodontitis with a few suspected carious lesions and a lack of salivary flow, caused from medications. After her appointment, you explain to her the importance of her oral hygiene given her current condition. You explain how diabetes contributes to the progression of periodontal disease and suggest salivary supplements in the presence of xerostomia. You explain how some of her medications can cause oral candidiasis and how to observe for signs of it. You place Sandra on a 3-month recall to control her moderate periodontal disease and refer to a DDS for follow-up on her possible caries. You explain the use of fluoride toothpaste and desensitizers to manage her sensitivity. You send her home with oral hygiene instructions on proper brushing and flossing and hope she implements them. You explain that each appointment will be managed at her comfort level to minimize anxiety and morning appointments are best suited for someone with diabetes. She leaves the office excited about coming back to see you for her next appointment and seems very happy you were there to educate her.